Okay, everybody. For our next step in these videos, we're going to do a normal pre-hospital delivery. We've been called to Jessica here. Jessica is a 23-year-old female, G4P3, which basically means she's been pregnant 4 times. She's had 3 babies. She's delivered 3 babies, and this is the 4th. So after today, she'll be G4P4. She's currently 38 weeks pregnant, and her waters are broken. She's in active labour, that's what we've been called to. So the first thing I'm going to do is just assess. Sorry, Jessica, I just need a quick look just to make sure, just to find out where we're at. Do you mind? No, that's okay. Okay. And we just had a look, and the baby looks like it's about to crown, so now we're going to stay and play rather than load and go, because delivering a baby in an ambulance is not a practical scenario in anyone's book unless absolutely necessary. Next thing I'm going to do is just do a quick ecology first thing I'm going to do is offer some pain relief. Methoxyfluorone, the green whistle, that's all in New South Wales, that's all that's appropriate for a lady in labour, a pregnant lady in labour. So would you like some pain relief? Yes, please. There you go. Does it hurt? Oh, a little bit. Okay, so I'll go through the whole scenario of giving her the methoxyfluorone. Then I'll go through my ecology, so estimated date of arrival, any past medical history, GP, her gravida, her parity, any problems with previous history, any previous pregnancies, any drugs that she might be on, any medication she might be using, just that sort of stuff basically, and just find out a full medical history if we've got time. Now we're at the point where we're having a look, and we can see that the baby's coming out, and it's the head's starting to come out of the vagina. It's actually coming out head first, so that's all good. I'll give this to you. There you go, Mum. So just take it easy. Just take it easy there, Jessica. Just a little bit of reassurance from Mum, and just only push on contractions, please, Jessica. Okay. So she's going along great guns. So she's pushing the baby out. Out it comes. Now, just as the head comes out, we just quickly check to make sure there's nothing including the airway, and that the cord is out of the neck, away from the neck. That's all looking very good. So as the baby comes out, we're just sort of doing it. We're not any traction. There's no traction. We're just supporting the head as it comes out. So we're just supporting the head, just gentle supporting pressure. By this stage, I've already told my partner. I said, look, this is an active birth. We're going to birth here at home. Could you possibly get some backup heading, just in case anything goes wrong? So my partner's done that. They've come back in now. They're helping reassure Dad and reassure Mum and telling her how to use the green whistle appropriately, and we're going with that. So as the baby comes out, we just we ease it out in a J motion, and we're just getting that anterior shoulder. We're just getting that anterior shoulder around the pubis symphysis, just to make sure it doesn't get caught. So it's coming out nicely, and here comes the baby. And always, where we can, we have the nose of the baby to the mother's spine. So opposites basically. So the baby would be facing down or up, and the mum would be facing down or up, opposite to the baby. So as the baby comes out, we ease that shoulder. This is a very big baby, by the way. We ease it. How are you going there, Jessica? Oh, this is great. So as the baby comes out, we sort of move it in a J motion, and as it comes out, we get the baby and we place it on Mum's lap, on Mum's belly. So skin to skin at all times where possible. That helps with the oxytocin release from mother, which will help offset any postpartum hemorrhage or put off any postpartum hemorrhage. We then get some cord clamps, and we get the cord and 10 centimetres from the baby's belly, from the baby's abdomen, we put the first clamp on. Then we milk the cord a little bit. This is after the cord has stopped clamping, sorry. So the cord has to stop pulsating, sorry, first. The cord has stopped pulsating. We put the first clamp on 10 centimetres from the baby's umbilicus, and then we milk the cord a little bit, and then another 5 centimetres we put the second clamp on, so 15 centimetres from the baby, and between the two we cut the cord. If appropriate, you might ask Dad or Mum or the partner, whoever to, not the mother of the baby, but the other mother, if that's what they're doing. So you might get Dad to cut that cord if appropriate. So So we've done a rapid assessment on the baby. We've looked at the heart rate, the tone of the baby, and whether or not they've got a respirations. If we need to, we put put the baby on the mum's lap. We get a towel and we rub the baby down, some gentle stimulation, and dry the baby, rub the baby down, and that's if there is any sort of apnea, that's usually enough to offset any apnea. Baby's crying now, we've cut the cord. Now we say to mum, we want to give you some oxytocin. We explain why we need to give oxytocin to put off any postpartum hemorrhage, reduce the risk of postpartum hemorrhage. Mum says yes, so my partner's already drawn that up, or in the process of drawing that up, and then we give mum 10 units of oxytocin IM. We wrap the baby now, again keeping baby with mum at all times. We're appropriate, keep the baby close to mum, and then we just take our time and get her to hospital. There's no need to rush. The baby's fit and healthy, mum's fit and healthy, everything seems to be going fine. We're going to go to hospital, but we're not going to rush. We don't want mum to have a big adrenaline surge, because as we know, that offsets the actions of oxytocin. And that's it. Thank you.